Good afternoon, ladies and gentlemen. My name's Steve Duvall, and this is news on Sedona.biz. Today we're privileged to have with us Mr. Tom Jenny, who is the director of the Arizona chapter of
Americans for Prosperity.
Americans for Prosperity. Isn't that we all want? Prosperity? So we're going to talk about the Affordable Care Act and see if we can't make it affordable. Is it possible?
That's going to be pretty difficult the way things are right now. And we had been talking about this earlier, and at some point very soon you're going to see everybody, Democrats, Republicans, everybody trying to go back and fix this thing because it's just a big mess. The Obamacare legislation is really a mess. It's called the Affordable Care Act, but for many, many people, it's not affordable. We've got over 6 million people who have lost their insurance. The Obama administration claims that they've signed 7 million people up for the new insurance, but a lot of those people already had insurance. By some estimates, up to 80% of those people already had some kind of insurance. Meanwhile, you've got 6 million people who lost their insurance. So this thing's going to be the gift that keeps on giving. The United States Congress and the next president of the United States are going to be fixing this thing probably for years to come if it's not outright repealed.
Fixing it. Well, I remember seeing Nancy Pelosi saying, well, we'll just have to pass it and then see what's in it.
Well,
it's kind of scary.
Yeah, we're finding out little by little what's in it. And in many cases, it's very, very hard to tell from week to week because the president keeps changing the terms of the insurance and the deadlines, keeps moving the deadlines. So it's very, very hard, I think, from week to week. And that's one of the reasons why we're bringing to Sedona a policy expert on Obamacare, Dr. Jeff Singer from Phoenix. He's not only a general surgeon, he's also an expert on health insurance and health care policy. And he's going to be here Friday night, April 11th, to explain to people in Sedona over at the Cowboy Church starting at 6:30, to explain to people in Sedona how Obamacare is going to affect them. Because it's very, very difficult for a lot of people out there to know what's happening. And so he's going to explain, in many cases, how Obamacare is actually hurting people, how it's going to hurt people on Medicare, how it's pushing people into the Medicaid program, and how that may not be the best thing for a lot of people, and also people that lost their insurance. So he's going to be talking about all of these factors.
Well, I would think that a doctor would be the person that would really have the inside knowledge on how this Obamacare really works. And that's firsthand in the trench experience.
I think so. Some of these doctors are really down in the trenches and they don't have time to become policy experts. They're just trying to stay alive. They're just trying to keep their businesses going, trying to keep the doors open. And in many cases, this is getting tougher and tougher for doctors. So, and for some of that, Obamacare is to blame. So, but Dr. Singer, thank goodness, is not only a surgeon, and as I understand, a very good one, but also a policy expert. He's been studying healthcare policy for years.
Well, Obamacare is law, so it's done deal, right? Nothing to do. It's finished. Like it or don't like it, it's law. It's the law of the land.
Well, one of the funny things about our laws of the land, the legislation that's passed by Congress, is almost every single piece of legislation that's ever been passed has been modified multiple times. And as we said, everybody's going to want to go back and fix this thing as soon as possible. And in many cases, I think you've got Democrats who maybe would like to not admit that this is as bad as it is, and they'd like to get through the next election without having to admit that. But at some point, there is so much wrong with this legislation that even Democrats are going to want to go back and start fixing this.
Give me a for instance. What's wrong?
So, for instance, I'm trying to think of something that a Democrat would object to. There's an odd glitch in the incentives by which companies put people onto the exchange, where in many cases an individual who's employed by a company can go onto the exchange and get subsidized. But if that individual brings his or her family, he or she cannot take the whole family onto the exchange to get insured.
Really?
Yeah, and this is what they call the 9.5% glitch, and everybody can look that up on the web, the 9.5% glitch. But this is something that even Democrats, who are very conscientious oftentimes, and they're people that say that they've got compassion. And why would in the world would you want to insure an individual worker but not his or her family?
Especially if they had coverage before.
Absolutely. And then you've got huge other factors that everybody else, I think, in the country, other than Democrats, wants to fix. One of them is the Independent Payments Advisory Board. This is an unelected board of possibly 15 members. Currently, the only person on the board is Kathleen Sebelius, HHS Secretary. But eventually, this board is going to be tasked with doing very ham-handed, heavy cuts to Medicare reimbursement rates. And so what you'll end up with is if a healthcare service is bureaucratically not popular, or if it's politically not popular, that particular health service for seniors on Medicare will see its reimbursement rate reduced. And that is that's an immediate recipe for shortages in that area.
Well, these are all doctors, right? Pardon me for interrupting. This board, 15-member, the Health and Human Services Secretary, but the rest are doctors?
It could be
Medical
anybody.
professionals?
It does not necessarily have to be medical professionals.
Could be me. I don't know anything about Medicare or anything.
It could. There's really no guarantee. It'll be a political question who gets appointed to this board. And it's a huge problem because seniors are going to be facing shortages. And so what's going to happen is you'll go in to get your hip replacement or something, and the local hospital will say, "Gosh, we'd love to give it to you, but they've cut the reimbursement rate for that, and so we're not offering it." Or the next time we are going to offer it will be after October because that's the new fiscal year, and there's a certain number of these procedures we can do with the full reimbursement rate. So we're not just losing money hand over fist.
Well, I know that, I've watched my own personal experience. They pass a law and they make adjustments, and they kind of tweak it a little bit to make it work. Would this fall into that? Tweak it a bit and it'll work.
It needs a major overhaul.
It needs major tweaking.
Yeah, the easiest thing would be to repeal it and start over. There are pieces of the legislation, I think, that are not going to get repealed. There are large numbers. I suspect that the IPAB, the Independent Payments Advisory Board, this panel that's going to decide how to cut these reimbursements to Medicare, I'll bet you that thing gets repealed because it is so unpopular with seniors.
So what if
that
they
gets
repeal
repealed? But there are going to be some factors. I think the ban on insurance companies using pre-existing conditions. I have the feeling that's with us to stay, and we're going to have to find a way to deal with that so that it doesn't wreck and bankrupt insurance for all of us.
So we have the government managing a private industry. Is that a fair statement?
Very much so. And in fact, I think you could almost describe it as government trying to turn the healthcare industry into something like a very, very clunky public utility.
It's a little scary. So
Yeah,
it's very scary.
it is a little scary.
Oh,
yeah.
boy, another IRS. Okay. So what if they repeal it? Everything falls apart, right? Would there be any way of salvaging part of it? Or, kind of dream with me a little bit and see, all right, everybody's agreed this Obamacare thing does not work. Okay, so we've repealed it. Now what?
Now I think you have to go back and fix some of the problems the government had created for decades in the system. I'll be the first person to tell you, to tell anybody that the system we had before Obamacare was not a good system. In some ways, it was very high quality healthcare, but it was also outrageously expensive. And so if you were not a person who had government insurance through Medicare or Medicaid, if you didn't get insurance through your employer, if you're out there shopping in the individual and family markets, in some cases you faced ridiculously high premiums, and it was very, very tough. And you had a situation where people were dependent upon their doctors, and the Democrats definitely got this right. Dependent upon businesses, their employers, to keep them covered. And if you suddenly develop some condition and then you lose your job, now you're out there trying to find insurance out there in the private marketplace. Very, very tough thing to do. And we have messed up insurance in this country for 50 years straight. And that's going to take a lot to fix.
It will indeed. I want to mention again, this presentation will be happening with Dr. Jeff Singer and Tom Jenny here next Friday, the 11th of April, from 6:30 to 8:30 p.m. at the Canyon Trails Cowboy Church, which is at the corner of Dry Creek Road and White Bear Road down there by the library. Be a very interesting program, and you should all attend.
And I wanted to say something about this event, which is that it is very much about action. It's all about taking action. So Dr. Jeff Singer is going to explain to people in Sedona anybody who shows up, is going to explain to people in Sedona how they can take action in their personal life to avoid the damage of Obamacare. There are insurance choices they can make. There are healthcare lifestyle choices they can make. There are ways to route around, sometimes, to route around the damage that Obamacare is causing. And so he's going to give that advice. But the next thing we're doing is on Saturday, April 12th, the very following day at 9 a.m.
In the morning. Okay.
In the morning, we're going out, Americans for Prosperity is going out and doing doors and phones. We're going door to door, and you may have actually seen us out there wearing green shirts. Most of our volunteers are wearing green shirts. Going door to door and doing
Wearing the
surveys.
Buccaneer hats with we're going to go out and wake up the populace while we're there.
Yeah, we don't have the Buccaneer hats, but maybe we should. Because we're going door to door, talking to people, talking to residents of Sedona, and finding out, first of all, what they think, and then also trying to make it a two-way street and give them some information. One of the things we're really trying to do is to light a fire under Ann Kirkpatrick. Congressman Ann Kirkpatrick. She voted for Obamacare. Unfortunately, she's done very, very little to try to fix it. Even some of the symbolic votes she's missed out on. And so we're very concerned that she is stuck with this thing. And so we'd really like to get her to change course. And if she doesn't change course, I suspect maybe the voters here will change course on her.
Yeah. So, Tom, how much does it cost? The program, Friday night, Saturday morning.
Well, it's free. Now it's free, but not in the sense of free healthcare. We understand everything has a cost.
We thought there might be a stipend in there that if you go out and hit the streets, they might give you a free healthcare or something.
No, it's free. There's no charge to participate in either event. Now, if you show up with us on Saturday morning, we want you to go out and either do phone banks with us and put in some work, or go door to door. And so that involves a little bit of work.
So tell me a little bit about the organization before we wrap up here.
Well, Americans for Prosperity is the nation's largest free market grassroots organization. We're nonpartisan. Our mission is to get out there and mobilize citizen activists to take action and change the course of government away from big government, away from stifling regulation, away from crushing tax burdens, and to help us create a society that's prosperous where we're able to take care of the worst off, the people who through no fault of their own are hurt and just arrive at life injured. So we want a society that can take care of the worst off, but at the same time doesn't strangle the golden goose, doesn't strangle the productivity that makes America great.
It's not leaning towards socialism. We're just talking about what's fair and what's right.
Absolutely. We're very free market, and socialism is really the worst way to go. And you can see that in our healthcare system. In countries that have gone socialist, fully socialist with healthcare, you end up with the worst of all worlds. You end up with high prices and very, very low quality services. Relatively speaking, that's a very bad thing for people. If you're going to be sick, truly sick, in any country in the world, you want to be in the United States of America. Our system is ridiculously expensive, but that's because we've had this sort of government-private bad relationship where the government has subsidized heavily the demand side for healthcare and driven prices way, way up to the point where there's a lot of people who are stuck outside of that. And like I said before, if you don't have insurance from government, if you don't have insurance from your employer, things can be tough out there.
It can be.
And that's a system we've created through government. So we need to fix it. And we need to go to more free market solutions so that we can get lower prices in healthcare and higher quality, just like you see everywhere else in the free market.
Well, Tom, there's a theme. There's a theme that runs through this healthcare. There's a theme that runs through our taxation process. There's a theme that runs through our banking process. People are wanting to take back their country. Is that sorry if that's a bold thing to say, but it just seems like we're losing control of our country and we're wanting to rein it back in? Is that a fair statement, Tom?
That's absolutely true. And the one thing I would qualify is I would just remind everybody there, even though we are a free market organization, we're fiscally conservative, there was no golden age. In other words, it's not like we could go back to the 1980s and everything was great. We had big problems. Medicare was on its way to bankruptcy even then. So we don't want to say, and we had the whole problem even then of people being stuck in employer-provided care and worried about losing their employer-provided health insurance. So I don't want to make it sound like there was some golden age just a few years ago that we can get back to. We're not here to defend the policies of George W. Bush. He was a big government guy as far as we're concerned. So just because we're very, very much opposed to most of what Obama has been doing doesn't mean, if we just turn back the clock a few years, this country's got some pretty big problems we need to solve.
It's been incremental. It's just been sort of creeping up, and we're now at a point where we're going, whoa, wait a minute. What are we going to do here? Maybe too late to fix it. I don't know.
This is a very, very resourceful country.
Yeah.
It's amazing what we can do. We had a period there in the 1990s where Gingrich was in control of the House and Clinton was in charge of the White House, and we managed to slow down the growth of government spending for a few years, and we had surpluses, and we had a tech boom, and those are pretty good times. We had problems. Yeah. We needed to fix more problems, but if you just slow government down a little bit and give room to civil society and the free market to fix things, it's amazing what this country can do.
Things are happening faster and faster. It's getting more and more difficult to keep up. My goodness.
It is. And just speaking of that, we're out there with the new technology. We're out there going door to door in Sedona and all over this state with iPads. So, and they're amazingly easy to use. We train people for about 10 minutes. So if you show up on April 11th, we can give people some tutoring on that at our April 11th event. That's 6 o'clock in the evening. That's mostly policy. That's Dr. Singer talking about what you can do to deal with the damage of Obamacare. Okay. The next morning, Saturday morning, 9 a.m., we're going out and hitting the streets. And so we'll teach everybody how to use the iPad technology. If you're able to walk, we'd love for you to join us. We'd love for you to join us. If you can walk, we'd love for you to join us for an hour and get out and meet some of your fellow citizens and survey them and find out what they're thinking.
The old way, talk to people. I don't know what's wrong with that. I think it's a pretty good idea.
It works for us.
Okay. So listen, ladies and gentlemen, we're going to kind of wrap this up here with Mr. Tom Jenny, who is the director of the Americans for Prosperity Arizona chapter. And we're talking about Friday night, this coming Friday night, the 11th, from 6:30 to 8:30 at the Canyon Trails Cowboy Church at White Bear and Dry Creek Road. You come there, learn about Obamacare, listen to a doctor who's actually in the system, and he can answer all of your questions. And then Saturday morning, we're going to mount them out on the streets and talk to people and see if we can't bring some education back out to where people really would like to know what Obamacare is all about.
Great. And the one last thing I wanted to say is I wanted to give a special shout out and thanks to the Concerned Citizens of America group here, and especially Dwight and Andrea. They've been great. They've got a great meeting that they have every month and at the Cowboy Church, and they've been hugely helpful in helping us to set up this event. So please get in contact with the Concerned Citizens of America group right here in Sedona.
Okay. Thank you, ladies and gentlemen, for joining us today, and we'll see you on Friday night and Saturday morning. Thanks, Tom, for showing up.
Thank you.
Okay. Bye now.